everybody. How are you? My name is Juan Pablo Dipache. You might know me from Fuller House, AD, Dancing with the Stars, blah, blah, blah. But today I'm taking over LA Cares Facebook Live to talk about something very, very important, COVID-19 testing. And I'm going to do this with the wonderful Dr. Flores Uribe, who's here with us. Dr. Flores Uribe is an emergency room physician with the LA County Department of Health Services, who's now working on the COVID-19 testing access outreach. Hello, doctor.
Hi, good morning, Juan Pablo. Thank you so much. And I'm really excited to be with everyone on the call today.
Okay, so let's just get started, doctor. LA County is testing tens of thousands of people each week, right? Where and how can people get tested for COVID-19?
Yeah, that's right, Juan Pablo. We're testing tens of thousands of people a week through county testing all across LA County. The thing that I want to share with our viewers today is that the most important thing is to call your primary care doctor. So if you have a primary care doctor, you can call them, and any primary care doctor can actually provide the testing free of cost to the patient or the person who's getting tested. Now, a lot of our viewers or maybe even family members may not know how to get in touch with their primary care doctor or may not have a doctor. So there are resources through the county, including calling 211 and being able to register online. So if you call 211, their service is available in multiple languages. They can refer you to a primary care doctor, and they can also make an appointment for you to get tested at one of the county sites.
We are all worried about COVID-19, but should we all get tested? Is everyone allowed to get tested?
Yeah, that's a really good question. So what I would say is not everyone requires to get tested for COVID-19. The most important things that we can do is do those practices to keep us safe, right? If we're sick, stay home, wash our hands regularly, wear a face covering, and maintain 6 feet of physical distancing. Now, through DHS, as part of the LA County testing sites, we have prioritized groups of people that would be high risk or could get very sick if they were to have COVID-19. So the 3 categories that we think about are people who have symptoms are eligible to be tested. That's shortness of breath, cough, fever, headache, body aches, and several other symptoms that we'll talk about a little bit more. Anyone who's been exposed to someone who's tested positive for COVID-19 and has been a close contact to that. And then thirdly, anyone who is considered a high-risk group. That's essential workforce, people who work in skilled nursing facilities, anyone who could come into a lot of contact with people who could be, COVID positive.
Right. And would you say there are certain populations that are more impacted by COVID-19 than others?
Yes, unfortunately, the data does show this. And, to our listeners today, we see that communities of color, particularly the Latinx, the Black community, the Native Hawaiian Pacific Islander communities, are most impacted by COVID-19. In fact, we're seeing that mortality in these communities, or people who die from COVID-19, is 2 to 3 times higher in those populations than when we compare them to our white colleagues. A lot of times this could be because of several different reasons. We know that there is structural racism, and a lot of the communities that are highly impacted work in essential workforce positions. So it's their capacity to be able to stay home, for example, and telework is limited. A lot of our communities also live in multi-generational housing, which makes it harder to isolate. So there's a lot of reasons for this.
Yeah, you mentioned about how different it is for different people. Mm-hmm. In my case, because I work in the film and TV industry, since March, the industry, especially in LA, just completely shut down. And so we kind of had to somehow, stay home like everybody else. But not everybody could stop working. Like, for example, those who, are essential workers. I mean, what I was saying before is that once the film industry opened back up, or is trying to open back up right now, I'm shooting a movie in Utah. The precautions are enormous, and it is kind of like the new normal. When I got to Utah, I had to take 3 tests, and they all had to be negative, and I had to quarantine in my room for 8 days. So it does feel like now this new way of kind of dealing with things, and on set, it used to be such a social thing. Everybody talks to each other, but now it's a very clinical environment because of the wearing masks and the shields and the tests. So, it's kind of like a challenge, but it's a way to function and a way to not, be impacted so highly. But for those who cannot work from home, or for those who don't have, these precautions in place in their jobs, such as the essential frontline workers, what can they do to stay safe and prevent the COVID transmission?
Yeah, I would say that's really important to acknowledge, right? COVID-19 has impacted all of us, and every workplace is doing what they can to keep everybody safe. So I think that that's a great question to think about. What can we do as individuals to make sure that we're doing those safe practice behaviors? So even as an emergency doctor, I was used to seeing people and, my patients seeing my face. And that was a level of feeling closer to the patient and making it feel more personal. So we've had to take precautions everywhere, in the emergency department especially, but in any workplace, I would say there's very clear behaviors that we'd like to share with people, and anyone can take this, right? It's making sure that we're washing our hands frequently and often, and washing them for 20 seconds at the very least. That we're wearing a face covering whenever we're going out, whenever we're outside of our home, and especially in the workplace as well, if that's possible. The other piece of this is making sure that we're maintaining that 6 feet of physical distance. Now, you can apply this anywhere. If you are an essential workforce member and you're taking public transportation, for example, you can practice the hand washing, wearing a face covering, try to maintain the 6 feet of physical distancing. And in fact, some of my patients have actually said that they've taken bus routes, for example, that are less frequently trafficked or less crowded to be able to do these things. So I would say those are the big elements to work through in trying to keep everyone safe.
And there are several symptoms, right, to COVID-19. What are some of the common ones that everyone can identify?
Yeah, so this list, I'm going to say, is not completely inclusive, because as we learn more about COVID-19, we learn more about different symptoms. So currently, the symptoms that we think about with COVID-19 are that classic fever, cough, and shortness of breath. In addition to that, we have seen people who have COVID-19 who present with headaches, body aches, nausea, vomiting, diarrhea, as well as loss of taste and smell. So sore throat could also be something that can present in COVID-19. So in these cases, the most important thing would be making sure that if you have symptoms, you call your primary care doctor and try to think through whether or not you need a test. But keep yourself isolated from others and make sure you take those precautions. The other really important piece of this is that some people may have COVID and have no symptoms. So the message is really making sure that we take all those precautions to keep everybody safe.
Yeah, I remember it was March, right, when we all had to kind of stay home, and of course we all quarantined for months, those who could. My mom taught me to spray soapy water on all the groceries when I came back home from the grocery store, and it was hard to be without my family. I'm sure everybody can relate. My parents live in Madrid, I live in LA, so I usually see them every 2 months, but I didn't see them for 7 months. And when I finally did see them, we sort of quarantined for almost, 2 weeks in different rooms to be able to say hello to each other. Or, she would bring me the tea to the door and I would just pick it up, or the food or whatever. But you mentioned that people should get tested if they're in close contact with someone who is positive. Can you explain what that means, to be in close contact?
Yeah. Exactly. I think that this is a question that comes up, right? If you live with other people and they may be going to work and someone tested positive, or you were in a car with someone, does that mean that you were a close contact? So to be clear, the definition of a close contact means that you were 6 feet away or less than 2 hand lengths away from the person for more than 15 minutes, or you exchanged body fluids. And what does that mean? Someone who has tested positive for COVID-19 sneezed in your face, or you kissed them, right? So those are exchanging of the body fluids. So in those cases, I would say if you don't have symptoms and have been exposed in that way in a close contact, then you would be eligible to getting tested. The other piece that you mentioned is those elements in terms of what you do at home, right? And there are recommendations to follow what we call the 3 C's. And the 3 C's to remember are really thinking about, trying to stay away from closed spaces, 1, 2, crowded places, and then 3, the close contact settings. So if we remember those 3 C's, that will also help us kind of remember how to stay safe.
So once more, closed spaces.
Mm-hmm. Closed spaces, crowded places, and close contact settings.
Perfect. Close contact settings. And what if you've been in contact with someone who has COVID-19, but you don't have any symptoms? Should people without symptoms get tested too?
Yeah. So in this case, I would say you can call your primary care doctor first. And it is one of the eligibility criterias, right? Even if you don't have symptoms, but you've been in a close contact with someone who tested positive for COVID-19, you are eligible for testing. The important piece there is that the recommendation is still going to be the same, whether you test positive or negative, because not every test is perfect. We recommend that everyone stay in that quarantine period, those 14 days away from other people, to make sure that, we reduce the transmission of COVID-19.
Okay. And how can someone get tested?
Yes. So we can call our primary care doctors first. They have tests and they can provide that test for their patients. You can also call 211 and they can refer you to a primary care doctor as well as get you an appointment for testing. Or you can visit the LA County COVID-19.lacounty.gov/testing website, which will be available on the Facebook live feed to make an appointment online.
And to demystify the tests as well, are there different types of tests that LA Care is offering, or is there the one test that people can expect? And how is that test?
Mm-hmm. So there are various tests across the county, and each health plan, for example, like LA Care or LA County Department of Health Services across the county, we all function in terms of using the test that we know in the moment can provide the most information and be as accurate as possible. So some tests do go through the nose, some tests go through the mouth. All tests are to make sure that we can get the best information in terms of whether or not someone has COVID-19 or not.
And just to put it out there, I did both test and nose and mouth, and it's fine. It doesn't hurt. It's just a moment of, ooh, and that's it. So it's not like someone is prodding you, and it's fine. It's absolutely fine. Yeah. What can people without a car do? Like if you don't have a car to get to the appointment or the test, what can they do?
Yeah, there's a lot of people who question whether or not the tests across the county, for example, have access if you don't have a car. So many of our testing sites are actually walk-up capable, which means that you can make an appointment either via phone or online, and you can walk up to your testing appointment. The same recommendations would apply, right? Wearing a face covering, staying 6 feet away from others, but over almost 40 of our testing sites have capacity to do walk-up testing site. And you can find that information out on our web page.
Awesome. And how long does it take to get results?
Yeah, so this varies, as you can imagine, based on the number of people who are getting tested. And this has been true even across the country. So there is variation in terms of when you get your testing results back. I want to say that on average, it's about 3 to 5 days. Now, that can take a little longer sometimes. The most important thing, as I mentioned before, is that during that time that you're waiting, that you maintain those precautions. You isolate and stay away from others, wear a face covering, stay 6 feet away, and wash your hands often. And if you're having symptoms, please don't go to work.
Well, like I said, testing wasn't. Actually, I had another type as well. I had the blood, the finger prick, and also the antibodies. So I feel like I've done my rounds of testing for different reasons. I was traveling home, like I said, to see my folks, so I wanted to make sure. I spoke with my doctor, and he's like, okay, if you're traveling, we can do the test. And I was able to get back to work after testing 3 times in a row. Like I said, I was quarantined in this hotel room here. It's nice, but after a week, I'm like, I can't do anything. So I had to be negative 3 times in order to be allowed to work. But if someone tests positive for COVID-19, what should they do?
Yeah, so I think that those are really good points, right? We know, and we have learned over the last several months, that someone can stay positive on a test for up to 3 months, even though they may not be infectious or have symptoms anymore. So the most important thing that anyone can do when they test positive or when they have symptoms is to do that self-isolation, to stay home, stay away from others, to prevent the spread of COVID-19. So the current recommendations now are that you stay home for 10 days from the first time that you had symptoms, and then at least 24 hours without any symptoms and without having fever while taking any medication that could bring a fever down, like Tylenol or ibuprofen. So those would be the most important recommendations.
Right. And if they test negative for COVID-19, what should people do?
Yeah, so if they test negative and they have symptoms, the recommendations would be the same. So like we know with any other medical test, no test is perfect. And in fact, someone can test negative and may still have coronavirus.
Right.
So it's really important that if you have symptoms and even if you tested negative for COVID-19, that you maintain those same recommendations. 10 days at home from the first time that you had symptoms, and then that 24-hour without symptoms. Now, if this was a close contact, right, and you didn't have symptoms, then the recommendation would be to maintain those 14 days of isolation.
Okay. And just to also talk about masks for a second. Are all masks the same? Should people lean towards using a type of masks than others? What's your expertise on that?
Yeah, there are some recommendations in terms of, what would be an adequate mask or face covering, right? So we want to have at least 2 layers, 3 if possible. And this could be a cloth face covering, or it could be one of the face coverings that, you get from Home Depot or one of the stores that is already built. The important thing about a face covering is that it covers both your mouth and your nose. You don't need any of the other ones that have the high-tech gadgets or like the breathing valves on the end. One of the simple masks would work in terms of protection. The other piece that is really important is that the recommendations are actually not to put on a face covering on someone who has breathing problems, right? Or a child, a very young child. And typically that's about, less than 2 years old. This is to make sure that everyone can breathe comfortably and stay safe with the face covering.
Okay. And some people may be afraid to get tested because they worry that it might be expensive or they have to pay a lot. But is the COVID test free or not?
Yeah, even as an emergency doctor, this is a question that a lot of my patients have, like, where can I get it? And is it going to cost me? And even some of my patients have concerns about immigration status, right? Or being undocumented. And what does that mean when they get tested? So I'm happy to say that in the county of Los Angeles and the testing sites that are available, testing is available regardless of ability to pay, regardless of insurance status, and regardless of immigration status. That information is private and will not be shared. And the most important thing is that we're providing testing access to our most vulnerable populations.
Amazing. That is amazing. Well, those are all the questions that we have at the moment. And to all our viewers, I just want to say thank you for keeping your family safe, your friends, all of Los Angeles safe by wearing a mask, avoiding closed spaces, crowded places, and close contact settings. Closed spaces, crowded places, and close contact settings. And please, 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 if you, and this is from me to you, I've experienced someone close to my family passing from COVID-19. And that changes your point of view on how serious you take this. So don't wait for that to happen. Please be careful. And thank you so much, Dr. Flores Uribe. You are amazing. You're doing incredible work. You're actually saving the world, literally. Mm-hmm. So thank you so much.
Yeah, thank you so much, Juan Pablo, for spending time with us and sharing this message. I think that that's exactly right. We all have a part in making sure that we stay safe, and everyone, can take care of one another and our family members by doing those basic practices, right? Staying 6 feet away, washing our hands frequently, wearing a face covering. I also want to, share that I and many of us understand that COVID-19 isn't the only thing that's impacting our communities. I hear it from my patients. I hear it from family members, right? There's real struggles with getting access to food, access to rent support, access to mental health services. And I also wanted to share that testing is one piece of this, but there are so many other social services available. And there are community resources available on our COVID-19 testing website and through LA Care for those very exact things: access to food, rent support, and mental health services. So please be sure to follow LA County and LA Care on Facebook and Instagram. There'll be important information and updates on COVID-19 and more information on how to get tested in some of these resources. I also want to say that together we can do this and we can stay safe if we practice those behavioral settings. So I thank you for the opportunity to share here, and I think that we'll probably transition to the last bit in Spanish. I was also curious, Juan Pablo, from your experience in kind of sharing with us in these messaging, what has been the most challenging thing for you?
Well, I guess with time, with the months, you sort of start to realize that it's not that bad. Like, it's not that bad to make an effort to wear a mask, to be 6 feet away from people, to have Zoom communications or, video communications with your loved ones. It's not the end of the world. And I always think it's for another 5 minutes, meaning another 5 months. So we can do this. It's not that hard. So please, everybody, just do everything you can to protect yourself, protect others. This will pass, and if anything, it's teaching us to be more united and more careful with each other and more, loving, I think. So thank you again.